Nice to see you.
Likewise.
What I want to ask you first is how you became a dentist. It was your dream, or why dentist? Why not dental technician?
Well, I guess I was starting the track to go to medical school, and then I went to college. My undergrad was in biology. I was a pre-med major, and then I worked on an ambulance for a while as an EMT, and I realized it probably wasn't for me. So then I didn't really know what I was going to do. I was going to be a senior in college without a definitive plan. I went and studied as a foreign exchange student in Spain, and came back. And my roommate, he was a year younger than me. He's like, I'm going to apply to dental school. And I was like, a dentist? I could be a dentist. It's perfect. And so I took the dental exam, and then I worked as a dental assistant in Vernon Hills for a dentist, and applied to dental school, got in, and then here I am 24 years later.
But did you know before you even apply, it's the hardest professional medical field, dentist. Nobody knew, but it is.
It's
stressful.
It is. I thought that it would be better suited to my personality than working in medicine. Working in an ambulance, it was. I realized that I saw death and people at their most vulnerable, worst. And dentistry, it's it's still in the healthcare film, but it's just teeth. It's it's no life and death situations.
I'm saying it's only teeth, nobody die.
Yeah, that's right.
Did you grow up around here?
No, I grew up in Illinois, but I grew up on a farm.
Wow.
By the Quad Cities, so it's just on the other side of the state. So if I hadn't become a dentist, so I graduated from college, and I was living at home, and I was working for my dad as a farmer, and so I was dating a girl from Deerfield who would not have made a very good farm wife. Wow. I don't think. So I knew I had to, and also all my friends were in Chicago, and I wanted to come out and.
Wow. Yeah. Farmer, recently I have an appointment today with a doctor and close to Wisconsin. Yeah. And his girlfriend, they have so many farms. I said, Doctor, why farms? He said, it's the best. It's when you're living in the farm, I don't know why, but you feel so much different. I said, how come dentistry close to the farm? And he said, no, you don't understand, you have to. And actually my wife to buy and have a farm.
Yeah, so I can appreciate it, and I think I would appreciate it more now. But sometimes when you're, you want what you don't have, and now that I see how I lived, then there's definitely some advantage. Just having all the unlimited space and the freedom to do what you want without having all the neighbors but I'm not going to be a farmer anytime soon.
Yeah, you don't miss farm life and city life.
Yeah,
different.
But it was a great way to grow up. I had we had livestock, cattle, horses. Wow. I had 4-wheelers, and so it was a great way to work.
When you were in dental school, any specific moments when you when you don't what was hard, or maybe it was easy? I don't know.
It definitely wasn't easy, but it was. I'm very proud of my dental school class rank. I was 27 out of 54, so right in the middle.
Okay.
That's where you want to be. And I had no major struggles. I was not someone that knew that I wanted to specialize, so I wasn't trying to get the absolute top of the class. But I wanted to learn and do the best that I could. But yeah, it was a difficult time, and there's all sorts of stress with patients and juggling, working clinically with also all of the lectures and coursework.
Do you remember your first patient?
My first patient in dental school was my mom. Yeah, so everyone.
You're not the first.
Yeah.
Yeah.
Well, I think most everyone would have their parents come in. So I remember you take the whole 3-hour appointment, chart every tooth, every probing. You do your cleaning. My mom was taking pictures the whole time. She was just so proud of us.
How did it go?
It was fine.
Yeah.
It was my mom.
It's simple crown or just
No, it was just a cleaning. Just initial exam and cleaning. remember there was a kid in my class that he brought his dad in who had one tooth.
One.
One.
Wow.
Yeah, but it was clean at the end. He got it really. He did a good job.
Do you remember maybe some funniest patient or maybe even weirdest patient in your practice? Probably you have so many.
I've got so many. I mean,
can imagine.
like, I mean, I could go on and on with like all. I think I've always said that I am a magnet for weird.
Really?
Yeah, I've attracted them. And I enjoy it. So my front desk will say, like, they'll hear about a patient that called, like a new patient, and they sound crazy or weird. Like, get them in. I want to see these. I want to meet these people.
Because like me, I remember the story, like, like wax train, right? Special on X, like, let's say upper and lower wax train, like all the way. And I remember we put wax train in the mouth, and doctor put everything good, and doctor just forget to take it in, and patient went home with wax train.
Wax train, yeah.
And nobody knew. And nighttime call, something happened. Patient was drinking coffee, and all teeth come out.
Yeah, I mean, I've heard this story from not just you. I've heard it from
probably everybody.
That's happened to many people.
Like, it's
like someone. There was a girl in my class who wanted her patient. Like, this is in dental school. Like, wanted his denture for an interview, and it's like, well, it's in wax. Like, you gotta be careful with it. So he took it. He used it for a while.
Really?
Yeah, just wax. Like for just we're looking at, right.
Wow.
You can't eat with those.
Do you remember any, like, maybe some specific case you still remember, just stuck with you? Like, I mean, I know so many cases, but probably some, like, big case, maybe, like, big veneer case, or, like, stuck with you, you remember this case. Maybe it was a hard one, I don't know.
I mean, obviously, there's lots of people, like, I don't know if I remember so much the case, so much as the people, people, like, the people. That you get to know them, you know so much about their lives, and you see them so often, especially for these full arch cases. You're seeing them through the whole process, and you do see them multiple times, especially if it doesn't go so well sometimes. Like, sometimes there's times where you have to redo things, not
one time.
Yeah.
But this kind of patient, like, do you have probably already, like, families, like, generations probably?
Of course,
right?
Yeah. I mean, I've got, I see the grandparents and the grandkids. I see, the whole, I've been there. I've been in my office for like 14 years now. So
in Northbrook.
In Northbrook, yeah. So I've been there for a while.
Wow. How do you keep this kind of positive vibe in the office? Make sure, like, like you said, some patient weird, some patient laughing, but you need to have some kind of vibes to keep them patients and personal about inside to keep them together. What
do I do for for my staff?
Staff, and all together, how it's in the office, because sometimes, let's say Friday it's crazy, and you have to keep everybody on a good leash.
Well, I mean, I think I have. It's a fine line between you have to be the boss and you have to manage, but also, especially with the hygienists, they're professionals, so you have to treat them as another, a professional, but you still have, your responsibilities you have to do what is best for your office and the patients, and sometimes that will, go against what they would want. But I try to keep the office atmosphere light, and not to be too strict about if everyone's following. I mean, I let them practice how they see fit, just making sure that everything's appropriate, but I try to stay hands off, especially for the hygienist in my office. As far as the front desk, that's a bit more of a struggle sometimes, keeping them in line, and they have a tough job, it's dealing with money. And I, like today I wasn't working, so I was answering the phones. If I'm sitting and doing work on the computer, the phone rings, I'm answering, and changing appointments or taking payments, and I screw up 50% of the time. I screw it up. I don't think I could do their job. I definitely could. Don't think I could do it as well as they do.
Wow. Let's talk maybe a little bit about more specific dentistry. What do you think, like, 3 easy things for people to keep their teeth nice, clean, healthy?
I think you should pick your parents. I think a lot of it is genetics. Sometimes I tell people all the time, like, I brush, I floss, I still have cavities. Like, life's not fair sometimes. But there's certain, like, things that you can do to help like mitigate like your hand that you have dentally. Like, obviously I'm a big fan of using electric toothbrush, using it for the full amount of time. I think water flossers are great. And then obviously like common sense with what you're consuming, cutting, sugary drinks and sweets and candy.
Yeah, so that's
obviously that kind of stuff. But I find that there's some people that like I see them in every 6 months and it looks like they have, they don't need to see me. Like you're doing a great job. I'd say, don't tell people I said this, but you really don't need to come see me. And there's some people that I think they should come in once a week and get their teeth cleaned because they just cannot seem to keep up with them. Like, and they have all these problems. So it's not a universal, one size fits all for everyone. But generally, everyone should be like coming in every 6 months.
But do you think any specific food, specific drinks? I know like Coke and everything, coffee, it just make your teeth, make your gum kind of more flammable. What do you think? Any specific food?
I mean, like if you have crowns, gummies will be pulling things out. I especially right after Halloween, I'm like so busy. Everyone's pulling their crowns out with all these gummies. Everyone has there's gummy everything now.
I know it's a big stuff now. I mean, not now, even before like Olonex, like you do, we do. Why do you think it's so popular, and why sometimes it's easy, sometimes it's hard to put it into? What do you think about Olonex, these all big cases?
Well, I mean, it's a way that someone can, have a full arch of functioning teeth without something removable that takes 8 months sometimes to extract, graft, removable denture. I mean, this is something where you can go in with failing dentition and come out with nice looking fixed restorations. I mean, that's the only option really. Everything else is
What do you think like myths people having about implants and about denture? Because some people, they never gonna put implants because they know it's so scary, or other way people never gonna put dentures because they said, no, I can wear a denture, just put me like 11 implants.
Well, I mean, I think one of the myths that people think about dental implants is unfortunately we see they're not always 100% reliable. Like, I see them and it's so frustrating sometimes that I might be in the minorities here, but I see bridges that last for 50 years, and I see implants that fail. They fail. They fail regularly, and it's a terrible problem. And I went through a period where I was placing implants, and I just I just didn't want to be the one managing the complications because whoever you're going to be, and so you're going to have complications, and that's so they're easy to place sometimes, and that's not the hard part. It's the problem is managing any issues that you might have. You're going to be the one placing these implants, so that's why I haven't placed an implant in about a year.
But a lot of patients come in and a lot of doctors saying, oh, you're gonna have implants, it's it, you're gonna forever. But it's not true because implants sometimes it's not up to us, it's just sometimes
luck of the draw. Sometimes you have they sometimes they will fail. Sometimes they're I see them 30 years later and the gingival level's great, the bone hasn't had any recession, but that is not the universal for every single patient.
Because they're not forever.
Yeah.
I just want to ask you about night guards because I know all my kids, they wear night guards. I know it's popular. Is it necessary or not necessary, night guards?
Well, my standard protocol when I see someone that has, wear, I will tell them to first try just an over-the-counter one, see if you can tolerate wearing it, because I don't want you. I don't want you just have me make you one, and then you I won't wear this, and look at it and think, oh, that dentist, he sold me this expensive thing. So I say, try it out, and then, but I make a lot of them, and my patients will wear them because they help. They wake up without facial pain and without their teeth, or they have they've cracked a couple teeth, and then they say they went through either needing a root canal or a crown, and they're okay wearing their night guards. So, but I have a lot of patients that wear them. I've made one. I was like, I don't.
You could.
I would.
Do you have any like gadget what you think? No, I can't live without that. I mean, not phone. Phone, I understand, but something like I don't know, maybe camera or maybe I don't know, like earpods, something like.
I use my AirPods a lot, but what I use and love my CEREC, like the acquisition unit, the scanner.
Really?
Yeah. Well, I don't make crowns at all. I just take I take photos before, after, and during every treatment.
Oh, with the scanner.
I have it, and and it's just as opposed to like I've had intraoral cameras, but sometimes they're really hard to use, and you have to click the computer, and they're like looking at a monitor in a different way. But this is right in front of me all the time. I can use it to like I just love how it's helped me practice. I can scan like pre-op and have, there's so many ways that I can use it, and it's very helpful. I used to mill my own crowns. I don't do that anymore. I'm happy to not do that anymore, but I do love the scanning as opposed to taking impressions.
Why? Because it's harder. I know it's better if somebody gonna do.
Right? Well, it's also like it took time, right? And so I'm busy enough that where like even that, and like I don't have enough chairs to put people.
Exactly. Yeah.
And so I'm a big fan of just scanning it, doing the best, making sure that everything, my margins, everything is how I want it, and then have a lab make the restoration.
What do you think, like, I don't know, everything now changing close to AI, digital, everything like moving away so fast. What do you think, like after 5-10 years from now, what dentistry, what's it going to be, what kind of dentistry is going to be?
I think a lot of our crowns are already made with AI, right? Obviously. But no one can replace me, at least not on the, and I don't think. I mean, I know they have the robots that can place like an implant, but I mean, there's no way that a robot can do what a very AI-proof. So that's I think this is every year.
Because for us, probably I'm thinking like if we need to take custom shade, probably nobody can take. I don't know. Maybe soon AI can do custom shade. But technician too, for example, if you have to make like two centrals identical, I think nobody can do except like real like good technician.
Yeah.
I mean molars, premolars probably not a problem.
Yeah.
Okay. If like on the horizon there be like a new dentist, young generation, what advice you can give them there about the dentistry?
Oh, the dentistry. Well, I mean, it's hard to like. So I was fortunate. I did not work. My first jobs were not in like a corporate type situation where I think a lot of dentists now are coming into. I was fortunate that I had some older mentor dentists that really helped, because I was like I would say most first year dentists right out of dental school are not equipped or don't know all the things that you need to know, like that you can only gain with experience. I mean, so many things you're not taught in dental school. You just have to either be taught when you're out and just through experience. And so, like, if you can, working in an office, like your first job it'd be helpful to be in an office that has like you could get a good mentorship, like working under a dentist.
I know dentistry is like a big hobby of you, but do you have any other hobby like you love a lot of too? I know you have a bike. I saw.
I like electric gadgets and toys.
Really?
Yeah, so I have like electric skateboards and electric bikes and motorcycles.
This one that I saw, it was electric, right?
Yeah.
Wow.
Yeah, it goes like 50 miles an hour.
Wow.
It's perfect.
Cool. Dr. J. Rodgers, thank you so much. I really appreciate it.
No problem.
And we'll see you soon again.